In this video, you'll learn what science really says about penis enlargement. We'll look at what works, what doesn't, the hidden dangers behind popular solutions, and practical, natural tools you can use right now to improve how you see your body, your erection quality, and your confidence. And while the focus is mostly on older men, everything you'll learn here also applies to younger guys. If you're looking for more control, confidence, and satisfaction, this video is for you. Most importantly, you'll discover the only non-surgical method with real potential for lasting improvement backed by data. And near the end, you'll see why some surgeries leave men disappointed, even after big promises. Stick with me until the end because that last piece of information might save you from making a decision you'd regret. Let's get started. Have you ever felt insecure about the size of your penis even without ever hearing a direct complaint? That feeling is more common than you might think. In studies with tens of thousands of men, about 45% to 55% said they wished their penis were larger. That means the discomfort is not rare, it's part of a quiet, shared concern among many men, especially as they age. But when that desire becomes overwhelming or misdirected, it can turn into something deeper. Penis size anxiety, a form of body dysmorphic disorder. Men with this condition are convinced they have a small penis even when they weigh completely within or above the normal range. This distorted self-image can create real suffering, affect relationships, reduce self-esteem, and interfere with everyday life. The average erect penis length is between 5.1 to 5.5 inches, with the normal range spanning from about 3.5 to 6.5 inches. In other words, most men are well within that range. Still, many compare themselves to unrealistic references, especially from pornography or exaggerated online claims, and end up believing they fall short. That belief can lead to shame, avoidance, and emotional withdrawal. Before looking for any solution, the first step should be internal. Are you really below average, or is your perception being shaped by insecurity? Seeking professional psychological support can be the most powerful action you take. A mental health specialist, especially one trained in men's health or sexual well-being, can help you understand how the problem lies in your body or in how you see it, and when perception shifts, everything else often improves too. For many men, anxiety and distorted beliefs were the real burden, not the body itself. And that shift doesn't require surgery or magic pills, just clarity, support, and honest reflection. Have you ever looked in the mirror and thought your penis looks smaller than it used to? That's more common than you think, especially as men get older. But the good news is that there are completely natural, free, and realistic ways to change how your penis looks without medication, surgery, or false promises. One of the biggest factors is fat accumulation in the pubic area. As body fat increases, especially around the abdomen, it often creates a soft layer above the base of the penis, making it look shorter. The truth is, it's still there, just hidden. Reducing overall body fat allows that base to become visible again, instantly improving appearance without changing anything structurally. Another visual trick that really works: trimming or shaving your pubic hair. A dense area of hair can cast shadows and make the penis look smaller. Keeping the area clean and trimmed carefully and with hygiene makes a noticeable difference in how defined and visible the base appears. Many men report increased confidence just from this small change alone, and it doesn't cost a thing, just a little attention. Finally, let's talk about anxiety. High stress or emotional tension can lead to poor blood flow and reduce the fullness of an erection. When your body is tense, the smooth muscles and the penis don't relax well, and that can make everything look smaller than it really is. Activities like walking, deep breathing, meditation, or even just unwinding with something you enjoy help relax the nervous system. When you're more relaxed, your body performs better, including your erections. If anxiety is intense or persistent, don't hesitate to seek medical help or mental health support. It can make a huge difference in how you feel and how you see yourself. So if you're looking for changes without spending a cent, Start here, lose a little weight, trim the area, and reduce stress. You'll be surprised how much your perception and confidence can change with simple, consistent actions. You've probably seen ads promising penis enlargement through miracle pills or gadgets that work while you sleep, but do any of these actually work, and more importantly, are they safe? When it comes to supplements, the first thing to understand is this: there is no pill that can permanently increase penis length. However, some natural compounds may improve erection quality, which can, in turn, make the penis appear fuller or longer during arousal. That's not because they lengthen the penis, but because they help you achieve a more complete erection. Some of the most studied ingredients include citrulline, ginseng, tribulus terrestris, and zinc, all linked to improved blood flow or testosterone regulation. These tend to help men with mild or moderate erectile dysfunction, if your erections have been weaker, and these supplements help restore firmness. The change in appearance might be noticeable, but that's a side effect of better function, not actual growth. Another device that often draws attention is the vacuum erection device, or VED. This tool uses a plastic cylinder and manual or battery-powered suction to draw blood into the penis. Once erect, a constriction ring is placed at the base to maintain the erection. These devices are FDA approved and widely used in the treatment of erectile dysfunction, especially in men recovering from prostate surgery. Some studies show that regular use 5 to 10 minutes daily can help preserve penile length after surgery, but for healthy men with no underlying conditions, there is no strong evidence that long-term use increases penis length, and using it incorrectly or excessively may cause bruising, swelling, or discomfort. That said, for men struggling with erection quality, these devices can be helpful, safe, and accessible when used correctly. But don't expect miracles. If something promises instant growth, be cautious. A more complete erection may improve your confidence and appearance, but it's not the same as gaining real length. If there's one non-surgical method with real potential to increase penis length, it's traction therapy. Unlike pills or creams, this approach has scientific studies behind it. The principle is simple: applying light, consistent stretching force to the penis over time can gradually stimulate tissue adaptation. That means real physical lengthening when done correctly and consistently. Early studies found that men who used traction devices for 4 to 6 hours a day over several months experienced average gains of 0.5 to 1 inch 1 to 2 centimeters in stretched or flaccid length. The device doesn't hurt. It should never be painful, but it may feel awkward at first. Over time, the tissue adapts. One newer device called RestoreX has been gaining attention. It's designed for ease of use and requires only 30 to 60 minutes a day. Studies have shown it to be particularly helpful for men who lost length after prostate surgery or those with shrinkage related to diabetes. Even in healthy men, it may help improve perceived length, but only when used regularly and over months. What's key here is consistency. You can't wear a device once or twice and expect results. You need to be committed to the process. Also, while minor side effects like skin irritation or swelling can happen, they are rare when the device is used properly. Traction devices offer something powerful, non-invasive, private, and evidence-based way to support penis length. For men who want results without surgery, this method can be a safe and realistic option as long as you're willing to be patient and persistent. The idea of injecting something under the skin of the penis to make it thicker can sound tempting. After all, it seems like a fast track to visible results. But do penis fillers actually deliver on their promise, and more importantly, are they safe? Today, the most widely used and relatively safe filler is hyaluronic acid. This is a substance naturally found in the body and already used in cosmetic procedures for the face and lips. When applied properly, it can increase the girth of the penis, but it does not increase length. In some cases, this cosmetic change can boost confidence, but make no mistake, it's purely aesthetic. The real danger arises when fillers are used in large quantities or by unqualified professionals. When not injected in small, controlled doses, complications like lumps, deformities, pain, and asymmetry are common. In severe cases, surgical correction is needed, and like most fillers, hyaluronic acid is not permanent. The body reabsorbs it gradually, so results typically last between 18 and 24 months. Worse still are the unauthorized substances some providers use, like silicone oils or other unapproved materials. These have caused severe complications including chronic inflammation, tissue damage, and even permanent deformities. Some reports show complication rates as high as 75% when unsafe substances are used. If you're considering this route, the first question you should ask is, what exactly is being injected? Then, who is performing the procedure, and how many times have they done it? Look for documented experience, published studies, and clear communication about risks. While fillers can provide aesthetic improvements when done responsibly, they do not increase actual penis length, they are not permanent, they carry risks, and they should never be chosen based on price or marketing alone. When natural methods fall short and the desire for change remains strong, many men start thinking about surgery. The promise is bold, visible, permanent results. But the reality is more complex and sometimes much riskier than it appears. The most common procedure is the suspensory ligament release surgery. This ligament anchors the penis to the pubic bone. When it's cut, part of the penis that normally stays inside the body drops forward, making it look longer in the flaccid state. However, it does not increase erect length. That visual gain comes at a price. The penis often becomes less stable during sexual activity, which increases the risk of injury. And without proper postoperative care, including daily use of a traction device, the ligament can heal in a way that pulls the penis back inward, sometimes resulting in even less visible length than BEF. Or, there is also the risk of damaging sensitive nerves in the upper part of the shaft, which may lead to reduced sensation or even erectile dysfunction. Another procedure involves placing a silicone sleeve under the skin of the penis. A recent study following nearly 300 men between 2020 and 2022 found that this method produced significant average gains, about 4.1 centimeters in length and 3.4 in girth. However, the risks were notable. Around 5% of patients developed an abnormal stretching of the implant, requiring a second surgery to correct it. Another 5% experienced erosion, where the implant pushed through the skin and had to be removed. Some developed hematomas that required intervention, and about 1.3% experienced infections that led to the full removal of the implant. While these percentages may seem small, it's important to remember that if something goes wrong with you, the impact is 100%. And in this case, the consequences may be permanent. That's why most experts recommend caution, even when the procedure is technically successful. Fewer than 1 in 3 men report high levels of satisfaction. Often, the emotional expectations are so high that the physical change simply doesn't fix the deeper issue. If you're seriously considering surgery, it's essential to ask the hard questions. How many of these procedures has your surgeon performed? What is their complication rate? Are there peer-reviewed studies supporting their technique? Search for answers yourself on medical databases like PubMed or Google Scholar. And above all, don't let marketing language guide a decision that affects your sexual health and emotional identity. The idea of using your own body to enhance penis size might seem more natural and safer than implants or synthetic fillers. That's why procedures involving fat or dermal grafts have become more popular in recent years. But what do these techniques actually deliver, and what do you need to know before considering them? In fat grafting, the surgeon removes fat from another part of your body, usually the abdomen or flanks, and injects it under the penile skin to increase girth. Dermal grafts use deeper layers of skin tissue taken from your own body and are implanted in a similar way. Both approaches aim to increase thickness, not length. So if your goal is more visual mass rather than physical extension, these may offer an initial improvement in appearance. Results are often noticeable at first, the penis looks fuller, which can boost confidence, but over time, the body tends to reabsorb some of the grafted tissue. In the case of fat grafting, studies suggest that between 20% to 40% of the added volume is naturally reabsorbed within the first year. That reabsorption isn't always uniform, and it can lead to irregularities in even shapes, bumps, or asymmetry. There's also the potential for infection, inflammation, and unwanted scar tissue. The dermal graft technique may offer slightly more durable results, but it still carries the risk of inconsistent outcomes. Another concern is unpredictability. Unlike implants, which have defined measurements, grafts depend entirely on how your body responds. Some men retain good volume long term, while others lose much of it and require additional procedures. And with each additional intervention, the risk of complications increases, particularly scarring or nerve sensitivity. If you're seriously considering this route, it's essential to work with an experienced surgeon. Ask how many times they've performed this exact procedure, what results they typically achieve, and what happens when revisions are needed. Ideally, they should also provide peer-reviewed evidence or clinical documentation. Natural-sounding options like fat grafting may seem safer, but they are still surgeries, and surgeries always carry risks. With so many methods, devices, and procedures available, it's natural to wonder what science really says about penis enlargement. What do medical organizations recommend? What's supported by real data and what's not? The European Association of Urology, one of the most respected authorities in men's health, released specific guidelines in 2023 addressing penis size concerns. These recommendations focus not only on physical conditions like penile shortening from trauma or surgery, but also on psychological cases, including body dysmorphic disorder related to penis size. The first thing these guidelines emphasize is that most men who believe they have a small penis are, in fact, within the normal range. In those cases, the priority should be psychological support, not medical intervention. Among non-invasive methods, penile traction therapy stands out as the only option with real evidence of effectiveness. It's especially helpful for men recovering from prostate surgery or suffering from disease-related shrinkage. But studies also show that even healthy men can benefit from regular, disciplined use, particularly in terms of increasing stretched or flaccid length. Traction devices are considered safe and can produce gradual, measurable results when used consistently over several months. Vacuum erection devices, on the other hand, are supported by solid evidence for improving erectile function, especially in men recovering from prostate removal. But when it comes to length enhancement, especially in healthy individuals, the data is far more limited. One study tested daily use over 6 months and found no statistically significant gains in penile length. What about hormones? Some men ask whether testosterone, HCG, or other hormone therapies can help with penis growth in adulthood. The answer is no. These treatments only affect penile development during puberty. After that stage, the receptors involved in growth no longer respond the same way. There is no scientific support for the use of hormones to increase penis size in adults. When it comes to cosmetic surgery, the guidelines take a cautious stance. Some procedures, like ligament release or silicone sleeve implants, may offer real changes, but the risks and dissatisfaction rates are high. These options should be considered only after proper psychological evaluation and when performed by experienced surgeons with documented results. The bottom line is this: scientific institutions recommend caution, clarity, and informed decision-making. Before trying any enlargement method, understand your motivation. Consult with trusted professionals and seek information from reliable sources. Evidence-based solutions may be slower, but they are safer and far more likely to give you peace of mind. Many men who feel dissatisfied with the size of their penis are actually reacting to something deeper than measurements. How we see our body isn't just about what's in the mirror, it's shaped by how we feel on the inside. That includes self-esteem, energy levels, hormonal balance, inflammation, and even how much control we feel over our health. The good news is that this perception can shift, and often, it changes naturally as your overall health improves. Losing body fat, especially around the waist, can make the base of the penis more visible, which often creates the impression of increased size. Just as important, it also changes how a man feels about his body. He starts to feel stronger, lighter, more agile, and more confident. That internal shift enhances how he views everything, including his sexual image. Nutrition also plays a powerful role. Eating more vegetables, healthy fats, and whole foods while cutting back on processed junk not only helps the body function better but also supports hormonal balance and blood flow. These changes improve performance, energy, and mental clarity, all of which reinforce a healthier sense of self. Sleep and stress are also key players. Men who sleep poorly or live in constant anxiety tend to feel disconnected from their bodies. On the other hand, those who prioritize rest, movement, and self-care often report a noticeable difference in how they see themselves even when nothing physical has changed dramatically. That's because perception is a reflection of emotional state, not just external appearance. And at the center of it all is self-esteem. When a man begins to feel proud of how he's treating his body, when he sees progress and consistency, that pride spills over into how he carries himself. He stands taller. He speaks with more confidence. And yes, he even sees himself differently in the bedroom. So if you want to improve how you feel about your penis, start by improving how you feel overall. That shift often brings the biggest, most lasting results of all. When a man starts to question his body, he usually focuses on one thing: size, as if the number in centimeters or inches were the ultimate measure of sexual value. But if you listen to real couples, read the clinical research, or simply talk openly with experienced partners, one truth becomes clear: pleasure doesn't come from size, it comes from connection, presence, and creativity. While some women may have preferences for larger penises, often for specific internal stimulation, most sexual satisfaction happens through clitoral stimulation, not penetration. And the clitoris doesn't care about size, oral sex, manual touch, toys, vibration. All of these provide more consistent and intense pleasure than most intercourse alone. So a man who knows how to stimulate, explore, and respond to his partner's needs can offer more satisfaction than someone who relies purely on size or firmness. Creativity also plays a central role: new positions, playful surprises, sensory exploration, communication. All of these unlock more pleasure than any physical trait. Even when erection quality changes or sensitivity fluctuates with age, creativity becomes the tool that brings joy back into the moment, and that often increases performance. Because the pressure is gone, the focus shifts from performance to experience, and the body follows naturally. And this isn't just about your partner, it's about you. Seeing your partner enjoy the experience, feeling confident in your own ability to lead, adapt, and connect, that builds self-esteem. It reinforces a sense of purpose and masculine identity. That's what makes a man feel attractive, respected, and desired regardless of size. So the real shift comes here. Stop focusing on what you're missing and start embracing what you can create. Let go of the measuring tape and focus on what really matters: connection, trust, attention, and intention. Those are the tools of unforgettable sex, not inches. Today you learned that wanting a larger penis is a common desire, but the real issue often isn't what's in the mirror, it's how you see yourself. We talked about how anxiety, excess fat near the pubic area, poor circulation, and unrealistic comparisons can distort perception. And you saw how simple, natural steps like losing weight, trimming hair, managing anxiety, or using traction devices can make a big difference. We also explored aesthetic methods like fillers, and more invasive ones like surgery, which can offer changes but come with serious risks and limitations. Most importantly, we reached the heart of it all: your emotional health, your confidence, and the quality of your sex life. If you've made it this far, congratulations. That alone shows you care about your well-being and that you're willing to seek out real information instead of false promises that deserves respect. And remember, your worth isn't measured in inches. It's found in how you care for your body, how you connect with others, and how you carry yourself with dignity. A fulfilling sex life isn't built on pressure or panic, it's built on trust, presence, and choices that truly reflect who you are. If this video helped you, share it with someone who might also benefit. And if you'd like to see more content like this focused on real, respectful solutions for men's intimate health, subscribe to the channel. We're in this together. Until next time, take good care of yourself.
Watch this video now, it will be useful to you. Let's go, believe in me. Don't miss this chance.